Good afternoon, everyone. We'll get started in just a minute. Joining us today. All right, we can go ahead and get started. Welcome, everyone, to today's internship virtual open house. We're so excited to have you here. I'm going to kick off introductions. We have most of our internships team here today. My name is Jay Weisgerber. My pronouns are they, them. I currently live on Agawam lands in western Massachusetts, also known as Chicopee. And at NICHQ, I am Associate Director of Communications and Digital Strategy. So I work on help projects with their comms as well as stuff for all of NICHQ. And I'm also on the internships team. And I'm going to pass it to my colleague, Dominique.
Hi there, I'm Dominique Davis, and I currently am on Seminole and Miccosukee land. I use she, her pronouns, and at NICHQ, I serve as the Communications and Digital Strategy Manager. So I support Jay in project communications, but also external and internal updates and content announcements. And I am going to pass it to Rebecca.
Thanks, Dominique. Hi, everyone. My name is Rebecca. My pronouns are she, her, and I'm on Pawtucket land. I'm a senior analyst in the Department of Applied Research and Evaluation, which is where I've been since 2021. So I'm a researcher and an internal evaluator for our projects at NICHQ. So I use both quantitative and qualitative methods to do this work. I would be supervising an intern for my department this summer, so I'm really excited to connect with everyone. And with that, I will pass it off to Madeline.
Thanks, Rebecca. My name is Madeline, and I use the She, Her series. And today I'm calling in from Pawtucket land, known as Roxbury, Massachusetts as well today. And I'm a prior intern that's now a project manager at NICHQ. I work currently on two projects, one related to improving the quality and coordination of care for patients with sickle cell disease, and one related to NICU equity with the New York State Department of Health. And in terms of the internship, I will be co-supervising and supporting one intern this summer on our sickle cell project. And so I'm super excited to be here with you all today. And I will pass it over to Eliza.
Thank you. Hi, everyone. This is Eliza Williamson. My pronouns are she, her, hers. I am on Pawtucket and Agawam land here in Ipswich, Massachusetts. I am an associate project director here at NICHQ, and I work on the Florida Children's Medical Services Learning and Action Network, as well as the environmental influences on child health outcomes, developmental impact on NICU exposure study. And I've been a part of the internship team here at NICHQ since 2019. In the past, have supervised summer interns and participated in the quality improvement course that you'll hear about in a bit. And I think I'll pass it to, did Sandra make it on? There you are.
Hi, everyone, and welcome. So nice to have a chance to get to know all of you. My name is Sandra Woodland. My pronouns are she, her. I live on Wampanoag land, and I am a project director with NICHQ. I work on the Florida Children's Medical Services Learning and Action Network. I've been with the organization for a while, just around 6 years. And in that time, I have worked continuously with the internship program. So I'm not sure, did Rinka go yet?
I'm not sure. Is she on yet? We're still waiting for her, but we're going to do a shout out. Rinka is hopefully going to join us. And then also shout out to Kelly Edwards, who's not here today, but she's part of the team. And if you intern with us, you'll be seeing a lot of her as well. So as we get started, I just want to let everyone know you can ask questions through the chat. There's also a Q&A feature. We'll have some specific breaks coming up to take questions, but you can ask them at any time.
So for the last 20 years, the National Institute for Children's Health Quality is really focused on driving dramatic changes and the complex issues facing children's health. We think of ourselves as a really bold organization of innovative thinkers and doers, and we're very proud to have earned a reputation as a national leader for improving the health and well-being of children and their families. Next slide.
Thanks, Rebecca. And NICHQ is motivated by our mission to drive change to improve children's health, as well as our vision where every child achieves their optimal health. And I'll pass it to Dominique to review our core values.
Yes, thanks, Madeline. So we've done some extensive work on our core values in the last year, and it's really been a collaborative effort with the entire NICHQ staff. We rewrote our values and we went from 4 values to 5, introducing equity this year as a new value. And that's really just putting an additional emphasis on what we're using as our guiding stars in our work and where we want to continue growing as we expand in the future. We're also really focused on collaboration. We want to engage diverse partners and continue to share and our learning with action and measurement. Our DARE department does a really great job of helping us share our findings after our projects are done. And we really have a series of projects that rely on collaborative networks. Our NMPQC network is a coordinating center, our Healthy Start TA Service Center. They provide technical assistance to Healthy Start grantees. So there's a lot of collaboration happening at NICHQ, and we really wanted to incorporate that in our values. Next is innovation. We want to be leaders in the maternal and child health area, creating and promoting new approaches for lasting systems change, and with a focus on children's health and improving that for every child. Data-driven impact is incredibly important here at NICHQ. We actually started more as a quality improvement organization and have continued to expand with each new project that we take on, but data has still remained a driving point in all of our works. Our DARE team, most of our projects, if not all, have a member of the DARE team on them to assist in terms of analyzing and really sharing the findings from the project work. And then last but not least is passion and influence. This was also a new spin on what one of our old values was, because we really wanted a value that spoke to what our staff does every day. When you speak to somebody at NICHQ, you know how passionate they are about children and families and improving children's health. And so we really wanted to make sure that shone through in our values. Next, I'm going to hand it to Rinka if she's made it on. Nope. Okay, well, I can take it. We are really wanting to engage with you all now, so we want to learn where you're from. If you can drop in the chat where you're from, and we'll share and see where all of us are joining in from today. I can start. I'm joining from Tampa, Florida. We have
I see
some
some answers in the Q&A. The
Q&A.
chat is disabled, but
Enable the
everyone is
chat.
so great that they are answering us in the Q&A portion. So we have some a UMass person, somebody from Boston, Connecticut, Puerto Rico, Virginia, Atlanta, North Carolina, Philadelphia, wow, Rhode Island, Oregon, Texas.
Okay, wow.
Amazing. So great to have you all.
I'm sorry, my stamp won't even let me get us all. But yes, we thank you all for joining us. And please, thank you for using the Q&A and thinking on your feet here for us. Let's stop annotating.
You gotta clear your annotations. That's funny. We're trying new features today. We thought everyone could do a
This
stamp
is
of
new
Zoom.
for us. Let's see.
Okay.
There we go.
Okay, so I can go next. This is Sandra. So I'm excited to talk to you about the NICHQ internship experience, and it's pretty awesome. So first, it goes from about anywhere from 8 to 12 weeks. So we like to set a minimum of 8 weeks, as that's the length of the quality improvement course. And I'm going to get into that in a minute. And 12 weeks really does run the span of the summer. So all of our interns are able to fulfill their hours within that time frame. So you'll usually see that people, our interns tend to stay with us between the time frame of about 8 to 12 weeks. So within that time frame, thinking about, thinking about hours, we can accept a range of hours, but thinking that we like to be as equitable as possible with that. So usually, most of our interns need about 200 hours, and then we have an intern who only needs 100 hours. We like to try and keep that pretty succinct throughout. So usually about 180 hours is sort of the average, and we are flexible within that, but that's pretty much usually what we see. So in terms of what we offer as a stipend, we offer a $1,000 stipend, which we're really excited to offer in our continued journey to be more equitable in everything that we do. And as far as networking opportunities are concerned, it's something that is really important for us at NICHQ, for you to have an opportunity to connect. And we believe that connections are so important. It's so important, in your sort of experience to be able to connect with the professionals around you, learn about what they're doing, and really share about what you're interested in doing too. And so we're really have like a clear mindset about making sure that you have lots of connections during your internship. So for example, we always schedule a meet and greet with our CEO, Dr. Scott Burns, and each of our interns have a meet and greet with him. We organize lots of meet and greets with other interns that are in the program. We schedule lunch and learns, and with the quality improvement course, we actually pair you with a QI buddy, and I use QI for quality improvement as an acronym, but we pair you with a buddy so that you really have someone that you work closely with as you go on this improvement journey. So to that end, let me tell you a little bit about the QI course, because I think that, and we all think that, it's a really unique experience and really unlike anything else that you'll experience in any other internship that you have. So essentially, the program, this QI course, meets for 1 hour weekly throughout the 8 weeks, and allows you to get to know everyone else at NICHQ, but to really hone in on a personal improvement project. So something that you're interested in improving about your life. And once you select what that is, and we can help you through that, we use QI methodology to help you see improvement with whatever that project is. So for example, in the past, some of our interns have worked on projects such as running a faster mile, learning to speak a new language, becoming more mindful in their life, decreasing social media time, and yes, even we had one project that was learning to do a handstand push-up. It was really fun, and they did a pretty good job towards meeting that accomplishment. But it's really about, having the opportunity to learn about this, this methodology through a fun and collaborative experience.
Thank you so much, Sandra. And then, I think all we had at the bottom of the slide we're going to talk about next are the 3 different types of internships that we offer at NICHQ. So kicking it off is our communications and digital strategy internship.
So I just want to share a little bit about what you'll do when you intern on the comms team. That's a mighty team of Jay and I, but we have a lot to get done, and we're really excited about hosting 3 interns, hopefully this summer. And so you'll get to learn about nonprofit branding and really liaise with our active projects. We meet with our projects, most projects weekly, to touch base and learn about the projects that they need us to support them on. And then we're offering 2 separate tracks for interns this summer, which is a first, and it'll be a website track and a social media track. So you'll be able to participate in some content production for social media, but really for the web as well. Social media campaign planning. We'll collaborate on content strategy that will thread through our social media, our emails, and then be lifted up on our website. You'll get to dabble in some paid social media, so some advertising that you'll be able to add to your resume. We also need some really extensive help with NICHQ.org. We have some project page enhancements that we want to make over the course of the summer, but we're also anticipating a website redesign for several projects and NICHQ as well. So we'll want to have some assistance and participation in that. We're currently on Drupal. So anybody in the tech world or website knows that it's an open source content management system that really requires a lot of coding. And so we're switching to the WordPress world for our projects and for NICHQ.org. And we're really excited for an intern to support with that work. You'll see some examples here on the side of some past intern support that we had. Last summer, we had 3 interns, and they all wrote a fully insight about one of our projects. So you'll see 2 here. One was about our NAPS IAM project, and they worked with the NAPS team to learn about goals for the project and really shape an outline to write a full-length insight. And then the other was about our sickle cell project. And so they worked with our HNCC team to really pull together work from not only this project, but the extensive history of the sickle cell work that NICHQ's done in the last 10 years. And then you'll see an example of social media. Our interns all took a social media channel last year and really made it their own. And so you'll see an example from our intern, Lindsay, and this got some great engagement. She shared about the new maternal health blueprints from the White House, and she came up with the content herself, made the graphic herself, and we even authorized that after we proof and approve that they were by the end of the summer posting everything themselves as well in HubSpot. So really get to have some hands-on experience on our team, on our tiny team of 2.
Yeah. And I just wanted to add, so we're planning to have 3 interns again this summer. And I just got breaking news, just got a text that our stipend has now increased to $1,500. So we just got approval for that. So very excited. Dominique, and now we'll hear about programs.
Yeah, so the programs department also offers internships where the intern would be working with one of our current projects. This is a great opportunity if you're interested in learning more about how public health projects run, quality improvement methods and tools, and generally how we work with our funders and partners, and learning more about project management. So what interns could work on during a programs department internship depends on the project that the intern is assigned to. But some of the typical areas of work you can see are listed there. Communicating with project participants and partners. Interns often support us with project meetings and webinars and get to sit in a lot of strategic planning and project meetings. Often we ask interns to support us in monitoring and facilitating communication on NICHQ's project online project platform. We call this the collaboratory or collab, and this is where our project participants can connect and share resources, so we get support in that way. And then interns often also contribute to digital communications activities. So you can see here just for a few specific examples. On the right here are some examples of work from the past interns have worked on. So at the top there is a one-pager checklist or infographic for onboarding family partners into a quality improvement team. And we actually still use this document today on the Florida project that we mentioned earlier. Interns often are participating in planning and day of support for hosting project webinar series. We've had an intern contribute to the planning. Actually, our very own Madeline here contribute to the planning and creation of a podcast on newborn screening follow-up for sickle cell disease. Interns have contributed to various written communications summarizing the project work going on, and these communications are for funders or other key audiences. So you'll see there's a snapshot of an annual report that an intern helped us with put together last year. The year previous, we had an intern help write a policy brief on equity and breastfeeding. So again, the work varies depending on which specific project you would be working with, but I hope that gives you a sense of some of the responsibilities that could be included for a project department intern. And I think I'll hand it to Rebecca next to talk about the DARE internship opportunity.
Thanks, Eliza. So I'm really excited to talk to you all about internships in the Department of Applied Research and Evaluation, which you've probably all heard we refer to as DARE for short. So you would be working with me and other senior members of DARE to support the execution of data and evaluation activities, which complement NICHQ's project work, as Eliza just discussed. So we do internal research and evaluation work to address social determinants and disparities in children's health and really show changes over time from our projects. You would be able to develop a knowledge around program evaluation, implementation science, research project design and planning, and some of your responsibilities could include coordinating data and evaluation activities, preparing institutional review board applications, assisting in developing interview protocols and surveys, potentially doing some data cleaning and analysis, or conducting literature reviews. So this is actually our first time having a DARE intern. We're really excited for this new opportunity to grow as a department, but because of that, we actually don't have any examples of DARE intern work to show. However, you can see on this slide that there's some really exciting snippets of recent DARE reports and journal publications. So hopefully you could contribute to some similar activities over the summer. So on the top is a journal publication that will be published in April in Nursing for Women's Health. And this article came out of the NAPSIN project, which aims to make safe sleep and breastfeeding a national norm. The article in the middle is a final evaluation report for a project on early childhood comprehensive systems. And the image on the bottom is a congressional report coming from the Sickle Cell Project.
All right, so I know we have quite a few questions in the Q&A tab, so we would love to open it up now for questions. I'll just go ahead and dive in and we can start making our way through the ones that are already there, but feel free to add any questions that you have. Let's start with what details do you all typically look for on intern resumes? I don't know if the team wants to jump in.
Yeah, I can start with that one,
Okay.
Eliza.
Thanks,
So
Sandra.
I think a cover letter is really important. And in the cover letter, it's always nice to see that you have become familiar with our organization, that you connect in some way with our mission and our vision. And maybe you could draw on experiences of your own that relate to our mission and vision. And certainly that you share with us what your interests are and what you're hoping to get out of this internship as well. So getting to know a little bit about you, a little bit about your experience, and how we as an organization and you as an individual make a good fit together.
Great. Thanks, Sandra. And I know that Jay is typing away and answering some of the questions in the chat. So I'll just move on to one that we can all discuss here. What can, oh, sorry, they're moving around. I think that it would be nice to talk about, I lost the question here.
Oh, was it like
I'm
around
sorry.
the hiring process or selection
Yes,
process?
I was gonna
Yes,
just
absolutely.
let everybody hear the answer to, is there a selection process to getting hired, so that everybody's aware of what our process is here. So applications close on March 12th. And then we, as Jay wrote there, will start to reach out. We used to use that first come, first serve, but this year we are going to just let all applications close, review everybody in a systematic way. We have a review process here that we go through and to make sure that the process is equitable. So not first come, first serve. All right, let's see, how many interns do you typically hire? That's a great question. I think we are always growing and expanding. This year, I know the communications team, you've slated for 3 interns. I think the programs department will take 3 or 4 interns, and then DARE is expecting to have 1 intern. Okay, next question. What would a typical day in the DARE program look like for an intern? Rebecca, do you want to take that one?
Sure. I meant to
Great
type an
question.
answer, but I hit the wrong thing. So we'll answer it live.
Perfect.
So this summer, we're really kicking off a lot of new research activities, which is and a lot of like new projects, which is why I mentioned specifically that an IRB application might very well be a component of what a DARE intern works on. So an IRB application has to be submitted before any research activities start, and it offers anybody who's participating in your activity recourse if they experience any physical or psychological harm. It's really like an equity concern, and it also is required if you want to publish the findings of your results in a peer-reviewed journal. And that's a really great skill set that you can really take with you anywhere. It's something that I developed in grad school and I've brought with me to every job subsequently. So definitely IRBs, developing surveys, developing interview guides. I think something that I really love about my job is that I sort of get to learn a lot of really interesting things, and I'm constantly like growing my skill set. So it definitely changes from day to day.
Thanks, Rebecca. All right, I am reading this great comment. I have a bachelor's in electrical engineering. Next thing I want to do is master's in public health. Could I leverage this internship to show that I've done some significant work for MPH application? Thank you. Anybody want to touch on that?
A lot of the, I think all of us can say that we'll provide a framework for, you know, a great internship experience. But you have the opportunity to make of this what you want. And so, you know, keeping that in mind, and again, you know, in your cover letter and sort of, if you have an interview with us, really sharing with us why you want to come to NICHQ and what you're hoping to get out of this. Oftentimes we can be, although we do have that framework, we'll be real flexible with you too, and making sure that you're getting what you need out of this as well.
Thanks, Sandra. Next question I'm looking at here is, do you all look for prior experience, or are internships entry-level friendly? I think we would all say this is a resounding entry-level friendly. We love to have green, bright excited new faces showing up here who are just excited to learn and improve alongside us. So happy to have you. It looks like, Jay, you're answering the question about Handshake. Anything you want to comment on about applying through Handshake in general that folks should know?
Yeah, so I think if we go to the next slide, we tried something new this year, using Handshake as an application portal. But what that does require is for us to get approved by your university. So I'm going to pop a link in the chat. If you don't see, our profile on this, or you don't see our jobs, right? They're down in the right-hand corner. If you don't see them, we just need to connect with your school to get approved. So all we need you to do, if you don't see them, is just email internship@nichq.org. Let us know what university you attend. If possible, to provide your Career Center contact would be amazing. And then we'll try to get it approved on Handshake. And worst case scenario, we have developed an alternative application process for those whose schools are not part of Handshake that we can send you, but we're trying to reduce use of that. So just send us an email and we'll get you help and make sure that you can apply in time. I think that's pretty much everything here. The way it works with Handshake is, we have to request approval from your school, and then they have to approve our job postings. So you might see us, but not fully connected, but just let us know. And then someone let me know about the form not working on our Handshake thing. It's our voluntary demographic information form, so we'll get that fixed, but I really appreciate you letting us know about that.
Okay. Thanks, Jay. The next question I see here, is there any interaction with the public? I will say for if that's talking about sort of externally to NICHQ for programs department, there's a lot of opportunity to interact with different partners, whether it is family partners, whether it's providers in a hospital setting, or participants from a community-based organization. Yes, the projects that we work on here at NICHQ, we're interacting with our external partners. And I don't know if Dare Communications, if you want to comment on how that interaction would work in your internship.
I think
sorry, you go, Dominique.
Sorry, Becca. With communications, there'll be opportunities to interact externally and internally. So through projects like Eliza mentioned, through our project support, you will have some external interaction opportunities as we develop content and we're interviewing staff experts or faculty experts, folks who are engaged with NICHQ through our projects. We expect and encourage you to take the lead on the content you're developing, to make the calls, do the interviews. Jay and I will be there to support, to edit, to help you outline and draft questions, but we really allow you to develop it from the ground up. So there'll be definitely internal and external opportunities to interact with and meet NICHQ staff in a more comprehensive way this year, but to also network with external partners.
So for DARE, I think external interaction is not quite as frequent as the comms and programs folks, but you could potentially interact with the public through disseminating our research findings. We do a fair amount of presentations, whether that's at conferences or in webinars, and also through data collection. When we do qualitative data collection, I have the great privilege of being able to regularly interview doulas and IBCLCs about the work they do, and that is always like one of the most rewarding parts of my job.
Thank you both. All right. I guess last call for questions. Thank you so much for your thoughtful and engaging questions. I hope we touched on them all. As you want to wrap us up, Jay, and as you wrap us up, we'll see if anything else comes through, and we can chat you a response. Thanks, everyone.
Sure. Absolutely. Well, to just let you know, reach out to us if you have any problems while, trying to apply or need any support. But in the meantime, please connect with us on social and sign up for our email and newsletters so you can stay in touch. But we really look forward to seeing your apps. Thank you all for attending today, and we look forward to welcoming some of you as interns this summer. Thanks again to the team today. Really appreciate your time.
Thanks,
Close
everyone.
this recording, we'll share it out.
Thanks, everyone.